Hi, Mr. Mancini. My name's Jordan. I'm one of the Level 2 Conestoga nursing students, and I'm going to be your nurse today. Can you please state your name and your date of birth so I can check it against your wristband? Okay, perfect. So today I'm going to be administering your 2 medication orders requested from the doctor. You'll be receiving heparin subcutaneously as well as Haldol intramuscularly. Do you have any questions before we start? Okay, so I'm just going to go prepare your medications and I'll be right back. Today I'm going to be preparing a subcutaneous as well as an intramuscular injection. So before entering the patient's room with the medications prepared already, it's really important to read over the orders that are in the MAR from the doctor. When looking over the orders in the MAR, you're going to ensure your 8 rights of medication administration. So you're going to make sure you have the right patient, the right medication, the right dose, the right frequency, the right time, the right route, and then the right site. These are all really important so that you know that this is the medication that Mr. Mancini should be getting. So now we're going to be choosing our needle sizes. So based off of Mr. Mancini's structure, his body build, the amount of tissue and fat he has, as well as the fact that he is a male, so he's a little bit more heavy built than a female would be. We're going to be choosing our 2 needle sizes. So for subcutaneous needle injections, I have chosen a 27 gauge needle with a 1/2 inch needle length. And then for our intramuscular, we're doing a 22 gauge needle with an 1.5 inch needle length. So for subcutaneous injections, we don't need the needle to be too long, nor do we need the diameter of it to be too wide. So a 1/2 inch should be sufficient enough. However, for intramuscular injections, we do need a slightly longer needle length to get right into that muscle so that we're not still in the tissue. The diameter of the needle sometimes has to be bigger as well just to get through. And then for those patients who may be a little bit larger, there are also times where we might have to even go down to an 18 gauge needle. So now we've gone to the dispensary and we've gotten out our 2 drugs. We have the heparin here, which is the dosage strength is 5,000 units per 1 milliliter, and our order from the physician is for 5,000 units. So therefore, we'll be drawing out 1 milliliter of fluid to inject into Mr. Mancini. We also have Haldol here. The dosage strength for this is 4 milligrams per 2 milliliters. And our order for Mr. Mancini is 1 milligram. So we'll be pulling out 1/2 milliliter of fluid to inject. And before we start preparing our injections, we're just going to do a little bit of hand hygiene. It's really important to do aseptic technique. So also when we go into Mr. Mancini's room, we're going to be putting on gloves just so that we lessen our risk of infection. So we're going to start and we're going to remove the little safety cap here. Then we're going to take an alcohol swab and we're going to begin to sanitize the top of the vial. This is again just to ensure that everything is sterile. And then we're going to open up our 27 gauge needle. And since Mr. Mancini's order for heparin is 1 milliliter, we're going to pull back some air. So after we've pulled back the air, we're going to remove the cap. And then we are going to inject the needle into the center of the seal. We are going to push the air in, and then we're going to invert. And then we're just going to let gravity kind of do its job and pull it back here. And then without touching the plunger, we're just going to pull back on the wrist. And we're just going to kind of flick out any air bubbles here. Get that to the top. And then as we can see here, we have 1 ml of fluid. So to keep safe needle technique, we're going to put the cap of the needle right against the little sharps container here so that our hands aren't putting the needle cap right back on. So you want to put it on a hard flat surface, and then you need something to push it up against. So then we're just going to cap the needle right back in here and then give a little push, and then it's safely capped because we're preparing the medication away from the bedside. So along with preparing the medications away from the bedside, it's really important just to write a quick little label of what the medication is as well as the dose, and just label the needle so that you know what you're bringing into your patient's room. And then we're just going to label it like that, and then we can tuck that to the side. So next we're going to be doing the Haldol. So we have the vial here. We're just going to, again, remove the cap, and we're also going to sanitize the top again. Again, just making sure everything is kept sterile. Then what we're going to do is we're going to open up our 22 gauge needle. So again, same technique as last time. So the injection we're giving Mr. Mancini is for 0.5 mil. So we're going to pull just past there, again making sure that we're not touching this inside of the plunger. We're going to remove the cap, and then we're going to stick the needle in there. We're going to push the fluid in, or the air in, sorry, and then we're going to invert. And then we'd want to make sure that the tip of the needle is below the level of the fluid. So you can see that the level of the fluid kind of stops towards the top, and then the needle is below there. And then we're going to let go of the plunger and let it pull back by gravity a little bit. And then we're just going to help it along. So then once we're at the 5 mil, we can just pull back on that. Tap out any air bubbles. Make sure we're right there. And then we have the 5 mils for injection. Again, following the safe needle technique, we're going to push up against the container to keep our hands out of the way, and then it's capped. And then we're going to write another little label for the Haldol, and then we're essentially ready to go. So then, since we're done preparing our injections, before we head to Mr. Mancini's room, it's really important just to tidy up our area and put any of our garbage or any medication vials into the appropriate receptacles, so that if you need a nurse to sign off on you dumping a medication, you need to make sure that's done before you leave the room, so that everything is clean and out of the way. Then before we head to Mr. Mancini's room, we're going to do some hand hygiene once again, and then we're going to put on some gloves. This is again to ensure aseptic technique to avoid infection for Mr. Mancini. Hi, Mr. Mancini. I'm back with the injections. So I'm just going to ask your full name and your date of birth so that I can compare it to your bracelet as well as the MAR. Perfect. So now we know that we've got the right medications for you. So we're going to start with your injection of heparin, which is going to be in your lower abdomen. So the 3 areas for subcutaneous injections is the abdomen, the anterior aspect of the thighs, as well as the back of the arms. So before we do the injection as well, we're just going to inspect the injection site that we're planning to go to. We're going to make sure there's no bruising or any irritation, inflammation, anything like that. And especially because we will be injecting heparin down here, it is a blood thinner, so you want to make sure you're not going to be worsening any possible underlying issues if there is bruising already there. So we're just going to take an alcohol prep wipe, and we're going to start by cleaning the area. So I'm going to go for Mr. Mancini's lower abdomen here because there is some fatty tissue. And then we're just going to start from the center and clean out in a circular pattern out 2 inches. Okay. All right. And then to perform the injection, so for a subcutaneous injection, you want to pinch the skin up so there's a nice big layer here, because you want to inject this kind of into the fatty tissue right below the skin. So you're going to start, so the area's been cleaned. We're going to start by removing the cap. And this is where we kind of have to be a little bit more careful so that you don't pinch too close and then stab your finger. So you're going to get a nice pinch and then kind of keep your hand away. You're going to hold the needle kind of like a dart, and you're going to go in at a 45-degree angle like that. And then you're just going to inject slowly, as well as keeping the bevel of the needle up. And then once it's injected, you're going to pull swiftly out and then just apply some pressure, as well as putting the needle directly into the sharps container. With heparin, we want to apply pressure for about 2 minutes just because it is a blood thinner. So we want to make sure that it has enough time to clot. Now we're going to be doing the intramuscular injection. So there are 3 places for intramuscular injections. It is the ventrogluteal, the vagus lateralis, which is on the thigh, and then the deltoid muscle as well, which is at the top of the arm. We use these injections because they go deep into the muscle tissue, which is really rich in blood supply. So we're going to start again, kind of the same way. We're going to locate Mr. Mancini's greater trochanter. So you're going to try and find the top of the thigh bone, which I'm feeling right there, which is where you're going to put the palm of your hand. And then you're going to kind of put your thumb towards the tummy, the index finger up towards the iliac crest, and then your other fingers kind of towards the back. So this area right in here is where you're going to want to be injecting. So we're going to start by cleaning again in a 2-inch circular motion starting at the center. And then what we're going to do is we're just going to leave our little alcohol pad there so that we know to inject right below it, so that we're not keeping our hand there and risking stabbing ourselves in the fingers. So now we're going to do the intramuscular injection. Now that we have the site cleaned, we're going to be demonstrating it here. So we have the 22 gauge needle. We're going to remove the cap. And then with IM injections, you kind of want to ask your patient to just take a couple deep breaths and relax a little bit, because you don't want those muscles to be tensed. So what we're going to do is we're going to just slightly pinch the skin, not quite as much as with a subcutaneous injection, but just a little bit so that there's a bit of a fold there. And then you're going to go in at a sharp 90-degree angle right into the muscle. And then what you're also going to want to do is aspirate back a little bit, just a tiny little pull on the plunger. And if you see a little red ribbon of blood, you know you're in the wrong spot, so you would have to start over. But if you don't see any blood, you're in the right spot and you know you're in the muscle. And then we can just inject right into the muscle, pull the needle straight out, and apply pressure again, and then dispose of the needle right into the sharps container. So now that Mr. Mancini has his injections, we're okay to remove our gloves and perform some hand hygiene. We're just going to kind of document how Mr. Mancini tolerated the injections, make sure he's comfortable, and then we're going to go and document in our MAR, sign off that we gave the injections as well as how it was tolerated.